Hello, my name is Ugo Uche, and I am a psychotherapist. The name of my private practice is Road to Resolutions. To learn more about my practice, you can visit me at road2resolutions.com. The website address would be in the description box. So the purpose of today's video is to discuss what anxiety is. You're going to learn what anxiety is, how to recognize the symptoms of anxiety, understand the causes of anxiety, and learn some basic coping strategies. So anxiety is a common and natural response to stress. This can be characterized by feelings of fear, apprehension, and nervousness. While stress is a response to a specific stressful situation, anxiety is a more persistent condition that can occur even without an obvious trigger. Now, even without an obvious trigger means there's always a trigger, but the trigger is not necessarily something that's happening in real time. Anxiety is a normal stress reaction, but it's problematic when it becomes overwhelming or chronic. Anxiety can lead to disorders such as generalized anxiety disorder, otherwise known as GAD, G-A-D, panic disorder, and social anxiety disorder. So to understand anxiety, we're going to look at what's normal versus when anxiety becomes a disorder. So feeling anxious is a normal part of life and can be beneficial in some situations by heightening alertness and performance, such as you're going for a hike on a trail and you come across a bear, right? You should be anxious, but calm, but anxious in that situation, and it will be understandable. However, when these feelings are excessive, consuming, and interfere with your daily life, they may indicate an anxiety disorder. So what are the types of anxiety disorders? Well, you have generalized anxiety disorder, otherwise known as GAD. This is characterized by chronic, exaggerated worry and tension about everyday life activities, even without an apparent reason for the worry. People with GAD often anticipate disaster and are overly concerned about health, money, family, or work. Oftentimes, this is related to childhood trauma. Sometimes it can be neurological. You may be born with it. The other type of anxiety is called panic disorder. This involves sudden, intense episodes of fear that trigger severe physical reactions when there is no real danger or apparent cause. Panic attacks can be terrifying, with symptoms often mimicking those of a heart attack. I mean, not really. Most people will, unless you've actually had a heart attack, most people will complain about chest pains, tightness around their chest. But other symptoms include sweaty palms, trying to catch your breath. Those are other symptoms of panic attacks. And it can last for a few minutes, from seconds to minutes. Another type of anxiety is social anxiety disorder. This is also popularly known as social phobia. This is characterized by an overwhelming worry and self-consciousness about everyday social situations. The worry often centers on the fear of being judged by others or behaving in a way that might cause embarrassment or ridicule. Right? Then you have specific phobias. Specific phobias involve an intense fear and aversion to specific objects or situations, such as fear of heights, flying, seeing blood, spiders. This level of fear is usually inappropriate to the situation and can cause individuals to avoid ordinary situations. There is similarities between generalized anxiety disorders and specific phobias. Then you have agoraphobia. This is the fear of being in places or situations from which escape might be difficult or embarrassing, or which help may not be available in the event of having a panic attack or panic-like symptoms. Fear of elevators comes to mind. People who usually, if you're on a plane or or on a bus, and they don't want to be tucked in between two passengers or sit by the window. They want to sit by the entranceway on a mild level. That's an example. Another type of anxiety disorder is also known as separation anxiety disorder. This is generally thought of as something that often affects children, but this can also affect adults. And it's characterized by excessive fear or anxiety about being separated from those whom the individual is attached to. So oftentimes there is overlap and comorbidity between different types of anxiety disorders. It's common for someone to experience more than one type of anxiety disorder, and anxiety disorders can also occur alongside other mental health conditions like depression. Depression is a common one that most people with anxiety disorders struggle from. So next, we're going to talk about understanding the symptoms of anxiety. Anxiety is not just a feeling of worry or fear. It has tangible symptoms that can affect your daily life, your health, and your well-being. And we can divide these symptoms into the physical and the psychological. So we're going to start with the physical symptoms. Increased heart rate. Anxiety can lead to a faster heart rate, making individuals feel as if their heart is racing. Breathing difficulties. This is usually common with panic attacks. Anxiety can cause rapid, shallow breathing or feelings of being unable to catch one's breath. This is usually known as hyperventilation. Sweating, excessive sweating, even in cool conditions or without physical exertion, is a common physical manifestations of anxiety. Trembling or shaking. Anxiety can cause shaking or trembling, often noticeable in the person's hands. Gastrointestinal issues. Anxiety can affect the digestive symptoms, leading to symptoms like nausea, diarrhea, and stomach aches. Fatigue and insomnia. Despite possibly feeling mentally and physically exhausted, people with anxiety may struggle with falling asleep or staying asleep. Muscle tension. Chronic muscle tension, particularly in the back, the neck, and the shoulders, are usually a frequent physical symptom of anxiety. Next, we're going to talk about the psychological symptoms of anxiety. Persistent worry. People with anxiety may experience constant, uncontrollable worry over matters big and small, often anticipating the worst. Irritability. People experiencing anxiety may seem unusually irritable or easily annoyed. Difficulty concentrating. The challenge that individuals with anxiety face in focusing on tasks or staying present, as worries can dominate their thoughts. It can lead to easily being distracted, difficulty organizing their thoughts, and organizing their personal affairs in real life. Restlessness. People with anxiety can feel on edge. They can feel restless. They can experience an overwhelming urge to move or fidget. This is a common psychological symptom of anxiety. The fear of losing control or going crazy. Severe anxiety can lead to a fear of losing control over oneself or one's situation. Avoidance of known triggers for anxiety or anxiety-provoking situations. Some people may go to great lengths to avoid situations or activities they fear will trigger the anxiety. So, what are some causes of anxiety? Well, you have biological factors. I think I mentioned that earlier, such as neurological wiring or atypical neurological issues from birth. Another one is, it's usually coupled with environmental factors, such as how the person was raised, if they experience significant trauma within their first 5 years of life. And this also leads to significant life events, the loss of a loved one, which is traumatic, stress at school or work, relationship issues, all of these can trigger anxiety disorders. So coping strategies. So some coping strategies, so we'll start with some self-help techniques, such as mindfulness meditation, deep breathing exercises, which are closely correlated with mindfulness, and regular exercise, having regular physical activity to manage, this can be very helpful when the anxiety is mild. It's important to adopt a healthy lifestyle. I just mentioned exercising, having a healthy diet. More specifically, I've noticed an improvement in focus and concentration when my clients have removed sugar from their diets, getting adequate sleep, and reducing alcohol intake. It's also important to remember that if your anxiety is moderate to severe, you can benefit from professional counseling. And a very effective type of counseling would be cognitive behavioral therapy. And in some cases, medication can also help. Well, thank you for your time. I would like to mention my book, Neuromastery, Retraining Your Brain to Overcome Panic, Fear, Anxiety, Retraining Your Brain to Overcome Anxiety, Fear, and Panic Attacks. It's out on Amazon today. The link will be in the description. And if you feel that you've enjoyed this video, I encourage you to subscribe and hit the like button. Thank you for your time, and take care.
Unlock the secrets of the mind with Neuromastery. Penned by a seasoned psychotherapist with over 21 years of experience, this book is a synthesis of cutting-edge cognitive neuroscience and deep-rooted counseling wisdom. The author's diverse experiences, coupled with his vast academic prowess, offer readers a transformative journey that unveils the mysteries of your brain's response to stress. Delve into the intricate pathways of anxiety and equip yourself with cognitive strategies, mindfulness, and more. Confront your fears and harness the magic of neuroplasticity to reshape your brain and life. Neuromastery, crafted by an expert, inspired by life, and designed for you.